Hello, I'm Dr. Dennis McKenna. I'm joined again today by Dr. Venditti, our Hospital System General Director. Today is day 26 of Incident Command related to the response to coronavirus in this region. Today we had a press conference on this campus with local area hospitals. We caught up afterwards with two of those physician leaders. Let's take a look.
I'm joined this afternoon by Dr. David Liebers, the Chief Medical Officer from Ellis Medicine. He's here to say a few words. I'd like to start by thanking David and Ellis for participating in this collaboration that's been going on across our region.
And Fred, I'd like to thank you and Albany Med for really putting this collaboration together, becoming the focal point, and allowing us hospitals in the region to really work together as a single unit to combat and mitigate this COVID pandemic.
We're here for the whole region together, right, David?
Absolutely, yes.
Okay. Thank you.
And it's been a pleasure working on this.
And I'm joined by Dr. Stephen Hanks, who's the Chief Clinical Officer at St. Peter's Health Partner. We are here today for a press conference, and I'm so grateful you could stay around for a couple moments. Steve, my wife worked for you at St. Peter's. She always said you were the best boss she ever worked for. I know why she said that. It's been a complete pleasure to work with you on this incredible COVID-19 pandemic response from the region. Thank you so much for joining us today.
And Dennis, I'll never forgive you for stealing your wife from me. She was one of our best colleagues at St. Peter's. But it's been absolutely fantastic to see the efforts of all of us in the region, not just St. Peter's and Albany Med as well as Ellis, but all of the hospitals from as far south as Columbia Memorial to as far north as Adirondack Medical Center to as far west as Bassett and Nathan Littauer, collaborating for the interests of the community in the midst of this pandemic. It's what healthcare is all about, and I couldn't be more proud to be part of this team in the Capital District.
You have an incredible workforce. We thank them, and we'll do this together.
As do you. Thank you so much.
Thank you. Thank you very much to Dr. Liebers and Dr. Hanks for being here, as well as all the physician leaders who joined us today at the press conference. So let's jump back into the numbers. Yesterday, we reported the number of positive COVID-19 cases in 5 counties: Albany, Rensselaer, Schenectady, Saratoga, and Columbia. Today, we report the number in those 5 counties is 618. Now, that represents about 50 cases more than it was yesterday. That's about an 8% increase. However, those cases are primarily, the new cases are not coming into the hospital. They're being treated as an outpatient. Inside here at Albany Medical Center, we have 45 positive cases of COVID-19. You'll recall yesterday that number was 44. The breakdown is 22 on the floor, 23 in the ICU, and of those we have 17 of those that are currently ventilated. We do know that among that population are transfers from downstate. So Fred, what's the update?
So yesterday we received a call from our colleagues down in Queens asking to transfer 25 patients. So we did what we said we were going to do, Dennis. We did this as a regional response. So 5 hospitals, including us, took those patients overnight. So we took 6 patients, 4 to our med-surg unit and 2 into critical care. So despite having taken 6 patients in transfer, I think yesterday we were at 44, today we're at 45 total patients in-house.
Excellent. One of the things that has been asked is whether or not taking those transfers in creates an environment that is less safe for people here at the medical center. So I want to talk about 2 things. The first thing is I want to take this opportunity to recognize the incredible workforce that we're representing here today, which is our environmental services workers, these men and women who work 24/7, making sure the environment here is not only clean but safe. Yes. For our workforce and for our patients. And so we salute you and we thank you for your incredible work, and we're very proud to be representing you today. The second piece is that we want people out there to know that if they have an emergency medical condition or if they're concerned about their health, they should seek care. They should call their doctor, they should seek urgent care, or they should come to the emergency department if that is appropriate, because this is a safe place to be treated. We don't want you to ignore your symptoms. If you're having some chest pain or an issue that you're concerned with, please seek help. Fred, you want to jump on that?
Absolutely. This is absolutely a safe place to come. Don't sit home with chest pain. Don't sit home with symptoms that you think are serious. Please come to the hospital.
Yeah, it's a safe place to be treated, and we want you to come in. So, Fred, I have a couple questions for you.
Absolutely.
A couple days ago, you reported out on how many of our healthcare workers had tested positive for COVID-19. That number, as I recall, was 45. What's the update?
Today it's around 50. And Dennis, I said the last time that most of those employees contracted the virus in the community, and that's still the case.
Okay, very good. And another thing I'd like to ask you is, I know you, Fred, you are a blood donor. You love to donate
I am.
blood.
Yep.
I share that passion about donating blood. I think you want to talk about that.
Thousands of community donation drives have been canceled around the country, and as you might imagine, that's created a huge shortage of blood. Blood is critically important for people who have surgery, trauma, etc. It's important that people donate blood. Please go to your local Red Cross and donate blood.
Excellent. Any questions for me?
Yes, Dennis. I think you have something special for us today.
I do. So another magnanimous contribution from the community to us. This is called Heroes Landing, and this is an opportunity for frontline care providers to get a little bit of respite, and this is going to take place over at the Hilton Garden Inn. So we thank them, we thank CEFCU, we thank BBL, we thank CDPHP and MVP to give our healthcare workers an opportunity just to take a little break for caring for the COVID-19 population. I'm pleased to say that will also be something that will be offered to workers at St. Peter's Health Partners. And so we thank them, and I'm sure our workforce does as well.
It's terrific. Okay. Thank you.
So today's Friday. As always, we will certainly be here working on the weekend, as will our incredible workforce. We often say to ourselves, it's not when you finish, it's why you finish. And we know that we're going to continue to work on this issue until we have beaten COVID-19, not only in this area, but all throughout the country. And so we thank you, and we ask you please to take care of yourself, take care of each other, and we will see you Monday.